Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Adrenaline in anaphylactic shock. If you see adrenaline in anaphylactic shock, the alpha 1 receptors they cause vasoconstriction and thus increase the diastolic blood pressure, whereas beta 1 receptors they increase the systolic blood pressure, and beta 2 receptors causes bronchodilation. Okay, so these all are important for adrenaline adrenaline usage in anaphylactic shock. It does not the alpha 2 receptors is not useful for adrenaline in anaphylactic shock. Thank you for watching.
Thank you for watching.